Namaskaram. Today we are here discussing about the health sector of India, the problem statement that we face in health city or in the concept of health, and what solutions KY thinks about them. This is all what we are going to talk about today. Now, if we consider the health sector, amidst this pandemic, we are short of so many crucial, essential, important things that we need to revive the patients. But we have come to realize about them only when this pandemic has appeared. Until then, everything was going on, there was not much problem, and things were going on routinely. And in this pandemic, we have come to know the availability of resources. We have come to know how much we are in the water and how much we are outside. And in this case, we realize that we are very short of all essential things. But the point is, this pandemic doesn't appear every year, right? The pandemic doesn't appear every year, and so we may not need these many resources every time. But even if we overlook this pandemic, which is very, very difficult, but even if we overlook the situation, which will subside maybe in 6 months or another one year, if we overlook this and we see further, definitely we will realize that the healthcare system is one of the neglected systems. And when this point comes into picture, everyone starts blaming the government, system, officials, authorities, etc. As a medico, I feel every one of us is responsible for what is happening in and around us. Simply blaming others and criticizing the authorities is not going to get anyone. Nothing. I am not defending anyone, but we must realize that we are responsible for what is happening around us. This is a very key and core concept in spirituality. Once man realizes this, he will never go for any kind of blame game. We think that just voting, we are done with our responsibilities and rest all is our right. It doesn't happen like that. If we are expecting something, first we need to do something for it. As medicos, I believe that there is much to our side that we can do and improve and improvise this health system to a much more extent. People may not agree with this concept, but I think if we want to have a Samruddha Bharat, if we want to have a Swarnim Bharat, if we want to again revive the entitlement of India as the Jagat Guru or Vishwa Guru, we need to develop our infrastructure for healthcare system. See, if the healthcare system is not good, definitely people will not be happy. If they are not happy, then they cannot think beyond the basic needs of life. We need to subside these basic needs of roti, kapda, makan, food, shelter and clothing. And now we add 2 more things, that is education and health. When these 5 basic facilities will be subsided, definitely man will think a level higher. But the problem is, we are not able to differentiate between the need and the greed. There is no strong dark line between the need and the greed. When man has a bicycle, he feels he should get a motorcycle. When he has a motorcycle, he feels he must get a car. When he gets a car, he feels he must go and travel in an airplane. And if he is more capable, he thinks he must have a private jet or he must have his own helicopter and a helipad and all this. We need to realize that this is all materialism and there is no end to it. It comes to no end. And we have come here with empty hands and we have to go empty-handed. So, serving humanity in the best possible way, in which one of the noble-most profession or the noble-most area of work is healthcare system. And here the discussion starts from avoiding diseases, from awareing from the diseases that we can avoid. And we see if COVID is an exception, then if we see the total graph of diseases currently in India or in the world, the trend of non-communicable diseases is rising to its peak. And it is because of the triad of the 3 main industries. One is the food industry. We are eating all rubbish. I don't even call it as junk food because it's not food, it is junk. Junk is rubbish. The second thing is eating a lot, we are getting diseases, so we are running to the hospital. So that's the healthcare system. And then healthcare system is prescribing us medicines as per whatever we have read in our textbooks, and we are going to the pharma industry, and these are probably the most giant industries on the planets, added to arms and ammunitions and the alcohol and liquor industry. Pharma industries and food industry and healthcare industry. I mean, there are so many predictions which say that healthcare industry is going to be the driving industry in the 21st century. It's unfortunate that today we need to call this healthcare noble profession as a healthcare industry, which is going to get jobs to people and money to people. Our culture was of seva, and we will describe them subsequently in the further points of this video. I have a 6-liner which I need to share, and that is, where there is integration of concepts, there is key to the door of intelligence. Where there is integration of concepts, there is key to the door of intelligence. Where there is key to the door of intelligence, there is application of knowledge. Where there is application of knowledge, there is synchrony in the treatment. When there is synchrony in the treatment, there is fitness of the patient. And when there is fitness of the patient, there is well-being in the society. And when there is well-being in the society, definitely there is progress of the nation. And I believe this 6-liner gives you the core concept that how this integration of concepts will help to develop intelligence, will help to make it applied in the applied aspect as knowledge, and this knowledge will bring about synchrony in the treatment, and this synchrony in the treatment will bring about the fitness of the patient, good prognosis of the patient, and if the prognosis is good, if the patient is fit, the society will be well enough, there will be well-being in the society, and if the society is flourishing, definitely the nation will progress. So as you can understand this link, what I want to say, healthier the nation, merrier the nation. Merrier the nation, more success, more progress it will do, because there needs to be some stabilization with respect to basic needs. Now coming to this important point, you will say that we are talking about healthcare, then from where all these basic needs come. These basic needs come because healthcare is one of the essential basic facility which is a right of each and every individual on this planet. If we can have animal hospitals, definitely humans are far more precious to us as compared to other animals. In our Shastras we talk about the concept of where Shri Krishna says Praninam Deham Ashrit, that he is there in each and every living being, non-living thing, everything. So there's no difference. But when it comes to scientific logic, people say definitely humans are more preferable. So if we are talking about the healthcare system, we need to think about these basic facilities. Why? Because the root cause of lack of resources is this. Actually, there is no deficiency of resources. There's disproportionality of the resources. You need to understand this concept, and I will discuss them one by one. Now see, when you talk about this gap, see this gap. There are 4,000 cities there are around 4,000 cities in India with more than 10 lakh populations. But to its contrast, there are 6.5 lakh villages which are there in India. So see this 4,000 and see this 6.5 lakh villages. Now as we all know that the cities are full-fledged with resources, overflown with resources. If someone just sneezes, he goes and visits to MD medicine for this routine medicines. And there on the village side, to its contrast, if the patient is dying out of tuberculosis, maybe there's no help. Because no one is going to his home, he lacks opportunities, he lacks resources, he lacks awareness, he lacks knowledge about healthcare system, about health facilities, about his own hygiene. And as a result, this disproportionality in the rural area is killing us like anything. We need to understand that India will progress only when the villages will progress, said Dr. APJ Abdul Kalam, said Mahatma Gandhi, said Swami Vivekananda. All these people realize this condition, this population statistics, and I think then only they have come to this conclusion. Now, when I am talking about this gap, the first point is the lack of resources in terms of disproportionality, not as deficiency. So first point is about resources. Second point I would like to highlight is about economy. Economy. According to some economical statistics and reports, we realize that in India, more than 90% of the money is with less than 1% population of India. So if we are a nation of 140 crores, 90% and more economy or revenue, it lies with less than 1% population, that is less than 1.4 crore rupees. Now, if we are considering everything in terms of money, then that is why this everything is becoming difficult. Paisa hai to sab hai. People are not realizing that there is someone who is handling the whole system and the creation. We think that money is working. It's not like that. It's definitely not like that. People with lakhs of resources, lakhs of, I'm LAKH, lakhs of resources, lakhs of hospitalization facilities, they're dying. Why? Because no one can fight time. No other resource, may it be money, may it be biggest post, may it be the biggest resource, it cannot fight time. Time is on one side and rest everything is on the other side. Still, time will be heavier. No one can control. And that is why we must forget this disproportionality. In terms of what is happening, people with lots of money, lots of resources, we are all told like that. Our education system is like that you focus on your career, you get good money, you get all these things. And then this gap continues. Now, the first point was resources. Second point was economy. Third point which I want to bring into notice about this gap is the transportation. You see, medicos or any other medical professional, they all want to, go and work in the urban areas. Why? Because there are more facilities, there are more opportunities, there are more payment, more business, more money. And overall the life is more lavish. They forget the basic purpose of life, and that is why they all are running, including all people around us, all are working and all are running behind these materialistic worlds and so-called satisfactions which are unending, never ending. And that is why this gap of healthcare professionals in rural and urban is increasing. There are very few who would like to go and practice in the rural, and many who are practicing in the rural sides maybe are doing so many malpractices, which there's a term called as quacks. Now, we don't want to blame anyone. What they are doing is for their bread and butter. We are responsible for doing things like that. Resolving this problem. Now, this transport point when I'm highlighting, the current government is working like anything behind building roads, spending lakhs of crores of rupees behind the transportation. So I believe to much extent this transportation problem will subside. Now, as I was telling, that people we are all wanting to go to the urban area. But if someone wants to work in Delhi, there's no place in Delhi. So if you want to talk about Delhi, everyone going to Gurgaon or Noida. Right? If we come to Mumbai, everyone is going to the suburbs. Coming to Pune, they're going to Pimpri Chinchwad, 40, 50 kilometers, 60 kilometers, 80 kilometers away from the main city. But still they are doing up and down across for their job. So if they can travel for an hour or two in the metropolitan cities for the same payment or a bit lesser, they can definitely travel. They can definitely travel to the rural places in a city, in a district which is not having a metropolitan city. For example, if I am talking about a city in Maharashtra, that is Solapur, where we are residing, definitely population is more than 10 lakh. So it is one of those 4,000 cities as I was telling you. But if you leave some very much distant areas, remote areas like Karmala and all, which are at a distance of 3 hours from the city, almost rest all of the places are at a distance of 1 to 2 hours of travel. And I think for the same amount of money which the government is paying to a medical officer in the rural area or a MD medical officer in a rural area, we can work. The transport facilities are developing, so if we can travel 2 hours from suburb to Mumbai, we can definitely travel from a basic village PHC to the city to live. If we are from the same village, there need to be kindling of the thought of seva amidst people. Now, I talked about resources, I talked about economy, I talked about the population statistics, 4,000 cities, 6.5 lakh villages. I talked about medical mentality, as I told you. I talked about transport facilities. And because of all these factors, the gap is increasing. And we need to understand that these all are modifiable factors. Now, this is the problem statement which I have mentioned. Okay. Now, talking about the solution part. Now, solution part is this. Okay, before the solution part, I will talk about the trends. Okay. In 1943, there was a committee known as Bohr Committee which was formed for genuinely finding out the ground level reality about healthcare sector, the resources available, the infrastructure available, and present a report to the then government or the then authority so that India could have a better planning for its health infrastructure and facilities. Now, this committee, which was formed in 1943 in named as Bohr Committee, after 3 years of vigorous study, it presented a report in 1946. And for that report, it put up a parallel, solution. What should be the standards of healthcare system in India? And as per those reports and presentations in 1946, when the population statistics of India was just 40 crores, today which is 140 crores, that is 3.5 times more than the population then. And in those norms, now, at that time they had said that there should be a PHC, primary healthcare center, for a population of 20,000 to 40,000. And that PHC should have at least a 75 bedded hospital with a staff of 40 people. 20 which will be trained staff, and 15 which should be the trained staff, and rest 20 to 25 people should be the untrained or the class 4 staff for rest of all the management. Now, 75 bedded hospital, forget, we don't find a 15 bedded hospital in PHCs. This is the condition after 75 years. There is no blame game to the government, not blaming any minister, any government, any authority. We did not raise our voice. We never focused until the pandemic appeared on our healthcare system, and we are responsible for this 100%, I believe. Blame game is not going to get us anyway. Okay, forget. Talking about the further the recommendations that the Bohr Committee made. So 6.5 lakh villages and a population of 40 to 20,000 to 40,000 should have one PHC. Now, 75 years back, when that area had a 20 to 40,000 population, definitely if total population has risen 3.5 times, the local population under that PHC has also risen 3 to 4 times on an average. So then, which was 40,000, today it is 1,20,000, and where there is one PHC, probably today we need 2 or 3 more PHCs over there, which we don't have. And for some 40,000 or 1 lakh population, which covers 20 to 60 villages, we are not having facilities enough to make their needs. Now, as we know, the distance between the villages is 2 to 4 kilometers or 6 to 7 kilometers, not more. But when 10 to 12 villages are having this one PHC, people resist to travel because of the unawareness, lack of health education, lack of basic education, and seriousness about health illnesses. That is why they keep on coughing if they have TB. The same problem we are facing for COVID. People are not realizing, staying at home, doing home remedies. I am not denying home remedies, but they never understand the drastic change of those parameters which suggest clinically that patient is deteriorating. and as a result patient goes into complications, and then we need oxygen beds, then we need remdesivir, then we need tocilizumab, then there's cytokine storm in the patient, then there's increased CT scan score, then there's fulminant massive spread of infection in the lungs, maybe secondary other diseases or complications. And if patient is comorbid, if he's aged, we cannot have a worst picture in front of us, worse than this. Then there's no point. But here no one talks like this, that I was not aware of my health, I did not take proper precautions, so I suffered from COVID. No one will say this. They will all say, I did not get bed, I did not get oxygen, I did not get this, I did not get a doctor's to see. But if we prevent ourselves properly, if we have a mask, if we sanitize our hands, this is basic step. No one wants to follow the protocol, and then we are putting up the blame game and never say that I am responsible. And what happens in the spirituality cycle, when we keep on blaming others, we get entangled with the person in terms of karma. And that is why we have to take rebirths, we have to face this bad and good time and keep on going, and this is spirituality apart. So talking about this, now PSC should have a 75 bedded hospital, a first referral unit or a CHC, community health center, should have at least a 450 bedded hospital, we never see this. And district healthcare hospital or the hospital which is allied or along with the medical college, it should have around 2,500 beds, which we don't see. Hardly 700, 800 beds or 1,000 beds that we are seeing. And this is the problem everywhere. Now, this is all about the recommendations made by the board committee. That is the requirement part. Now let me talk a bit about the economics and the approaches as a solution to this problem statement of healthcare. Now if you see, you will realize that everyone is saying paisa nahi hai, there's no economy, there's no budget, we are lack of money. No. Sorry. There are a few studies that Karmayogi Samstha has done. Okay, and we are just presenting them before you. There may be for's and against to the study, but if we consider the data of 2019 of the taxation for liquor of Tamil Nadu state, it is 30,000 crore rupees. 30,000 crore rupees. I'm just talking about the taxation amount. Forget about the selling price by which the liquor was sold. The common scene is, or the common question or the point which I want to bring to focus here is, if the government is getting 30,000 crore rupees taxation just for liquor, it means 100% liquor is sold to such an extent. Liquor is sold, so the shopkeepers are paying the tax. This is what we have on paper in terms of articles. Forget about the black market. Yeah. So we are having 30,000 crore rupees per year. The 2019 Tamil Nadu state, one of the highest earnings that the state got. So if it is for 1 year, definitely shopkeepers are paying the tax. And if shopkeepers are paying the tax, it means what? From where is the shopkeeper getting? People are purchasing it. And if the people are purchasing it, it means people are having money. But the direction of implementation or using of money is not correct. They are not using their money for proper resources, for proper functioning, for the development of themselves and the society. They are using it for addictions. So availability of the resources is not a big deal. How to use them, this sense of understanding needs to be kindled, and that comes only and only by education. Only and only by education. And we need to realize that education is one of the basic facilities, basic rights of a human being. But when that education itself is becoming a big market, when there is a 1 lakh rupee or more money required to get admitted for LKG admission as donation in private schools, I think this could be the biggest scams we can ever have. I will teach them for free, I am thinking. Yes, because there's no line between need and greed. There's no line between need and greed. Now coming to the point, if one state is having this much, I'll tell you another study which we have. In 2020-21, despite lockdown, despite the pandemic, the total taxation of liquor and tobacco which the whole country collected without the VAT, it was 14 lakh crore rupees. How much? 14 lakh crore rupees. And these are such big numbers that we can never think of. Now I was talking about health cities. What is a health city? It's a 2,000, 3,000 bedded hospital. The plan which Dr. Devi Shetty of Narayana Rudala is trying to implement in this society. Concept of health city. This concept of health city is crucial. Why? Because if we want to decrease the cost of healthcare system, definitely the number of services have to increase. This is the rule of business. If we sell something in retail, the cost is more. But if we go to the wholesale market, the cost decreases because the number has increased. And health city will play an essential role in decreasing the cost of healthcare, which is very important because 90% of the population is middle class, lower middle class and below it. And that is why this is very crucial for us. The second important thing is any kind of disease with complication or like that, coming to healthcare city must get some or the other relief, must get some solution, proper line of treatment there. And if we build the 2,000 bedded hospital, as per a few calculations which require 70 lakh rupees for a single bed of infrastructure to be developed in healthcare system, we can build a 2,000 bedded hospital in 1,500 crore rupees. And later on maintenance cost is different. But this 1,500 crore rupees, the amount that we discussed for the taxation that happened for liquor in 2019 in Tamil Nadu state, which is 30,000 crore rupees. So you can realize that in one state, in a budget of 1 year, whatever we are gaining from this liquor alcohol, which is not at all a basic need, not at all required, just a revenue based business, which is deteriorating health conditions of people, such kind of revenue, in that amount 30,000 crore rupees, we can build 20 such hospitals of 1,500 crore each, of 2,000 bed each in a state. So 20 such mega health cities which can give such a big project to the population, such a big healthcare setup to the society, I think we need them much. And as we know, as I already put up the number before you, 2020-21, the total governments from the country recovered 14 lakh crore rupees as taxation without VAT, just behind alcohol and liquor and tobacco. I think this is a very big number and we can definitely use some part of it for the healthcare system to be developed. And the thing is, this economic part plays a crucial role to start the whole project. Now I already discussed about the economy. Talking about the approaches, the problem what is happening, see, we are all stuck up in the market. Everyone is, most of them are practicing with money as the center. Many successful doctors have enlivened like this and they have said, like this means the one what I am saying, and they have said we don't have to be money centered, we don't have to be system centered, we have to be patient centered. I remember the words of late Padma Shri Padma Bhushan Dr. V. Shanta ma'am. She told us when she had come here. We have to be patient centric, not technology centric, not laboratory centric, not pharma centric, not money centric. We have to be patient centric, and this is the need of the hour. Currently what is happening, everyone is told you study hard, you get good degrees, and the first question is, what is your degree? MD, DM, okay, very big, very nice. Then next question, how much is salary, how much is the monthly income? And the third question is, how many holidays do you get? Means what? More money, more holidays are expected. Means we are teaching the young budding doctors about robbery of work. Working hours should be less and money should be more. What kind of trend? From where are we going to take this money? And why do we need money so much to such an extent? We belong to such a Sanskriti and culture where healthcare system and education system were given as seva. I would like to bring to your notice to each and everyone who is hearing this video that 2 centuries back in the 18th centuries, when before the British came to India, there were 7.5 lakh villages in this country. And each village of the 7.5 lakh villages in the country had its own education system, that is the Gurukulam Paddhati. Each village had its own Vaidya, and that Vaidya was responsible for the health and healthcare setup of the whole village. Definitely the population was not that much, and so one Vaidya could manage. Today technology has developed like anything. We do not deny the greatness of technology, but to the same extent the clinical medicine is dying. Patient coming with headache, we are asking to do CT scan, no clinical thing. What is the point? We are not supposed to treat the report, we are supposed to treat the patient. Patient is not coming to us as a case, patient is coming to us as a sufferer of his maladies. If we are treating the report, if we are looking towards the patient as a case, we are definitely gone and done with the ethics that we learn. And this is the root cause of all problem. And I think we are really responsible. That Vaidya who was responsible for the healthcare setup and the health of the whole village did not charge a single penny off from anyone. The village took care of the household needs and the complete family needs of the Vaidya as a part of, gratitude, as a feeling of thankfulness. Today the scenario is not like that. The patient thinks once I have paid the money, it means treatment should be in my feet, and money has become the center for them. All such patients should be slammed on their faces who take money for granted, healthcare things for granted. They do full body checkup for no reasons, they have nothing to do, no work, idle people, money, and money is pouring out of pockets, no place to keep. So they go, the 700 parameters that we check in the full body checkup, something will be less or more physiologically. And then you start the treatment for it. And no one will say, I am responsible. No one will say. In case of medicos, I would like to highlight this point very humbly. Please, we come from a very, very renowned, very, very civilized culture which says, Seva Paramo Dharma. Seva is the biggest dharma, Seva is the biggest religion. Selfless service is the biggest religion. But we are lacking this. Everyone, you talk anyone to any doctor or a budding medico. If you ask what you want to do in life, he will say, I want to become a successful doctor. They don't only understand the question, but they put up a wrong side. When we ask what do you want to do in life, they will say what I want to become in life. The question is, what do you want to do in life after? They will say, I want to become a doctor, I want to become this, I want to earn this much money, I want to settle in life. This is not the way, and this is the problem of the education system that we have. What to become is definitely secondary, what to do is more important. When we want to do something, automatically we get posts, automatically we get something in return, and that should be satisfying enough to us. If we are medicos, if we are real heroes, why do we need BMWs and Jaguars to move? This is lavishness, this is not seva. I am very sorry to say, but this is not the scene. So young budding doctors like me and you need to understand this kind of attitude towards life. Because we have come empty-handed and we have to go empty-handed. The car, money, bungalow, everything is going to stay here. Then what is the use of earning it? Better earn the blessings of patients who gets cured and goes home satisfactorily, and that gives you a satisfied smile on your face as a treating doctor. I beg and pray with both hands in front of you to realize and imply this attitude in life. And this attitude is only going to help us to modify the system. We have started, we are waiting for you. This is about medicos. Talking about the general population, people are eating. When I said non-communicable disease is the main problem. People are eating like anything. Because there's no purpose of eating. See, purpose of eating is hunger. But now no more it has remained as a purpose of eating. Today purpose of eating has become taste. Today purpose of eating has become, the lavishness. Today purpose of eating has become the standard. Today purpose of eating has become what people will think about me if I give them a party in a simple hotel. Attitude, money, this has become taste of the tongue. These all have become the purposes of eating, and when the purpose is not clear, definitely the problem is there. In Hindi say they, if the foundation is not good, we cannot expect something good to happen. अगर कोई चीज का मूल खराब है तो उसमें फूल कभी नहीं आएगा. तो आपका पर्पस ही अगर गलत है, if the purpose is wrong, definitely it will not have any fruitful results. So we are eating like anything. If we put kerosene in a petrol car, what will happen? We are doing the same thing, just eating junk. So this is leading to diseases, only that it is not happening acutely, so we are not alert. But despite all kinds of awareness campaigns, the food industry is running because they give revenue to the government, and no government will think about all the things. Government needs money to spend, money to run the country. And that is why it's up to you and me, my dear friends, and the normal population, the non-medical people, we need to understand. This food industry, eating, we are going to the healthcare industry. Then the doctors are charging, hospital is charging. No one will do it for free. There is nothing free in this world except for the name of God. There is nothing free in this world. Today we are paying for oxygen. Today we are paying for water. Time will come, we will need to pay for every single thing that we do. And you and me need to understand this is because of lack of satisfaction. This is because of the disproportionality that we have. This is because of the unending, unmet greed of the human population that we have. And this food industry connecting to health industry coming to pharma industry. We are prescribing medicines for no reason for many of the times. A multivitamin, this, that. Why? Because the pharma company is giving us a tour, right? One single trip to the foreign country and they say, we are ready to write whatever you say. This is foolishness. This is against the ethics. This practice is very common. I am aware of it, being a part of this. Maybe many will criticize me for this. But this is not the way how we should do. It's a very giant industry and it is influencing very much at the political level. But I think this is not the fate of the knowledge that we have gained over years together. Just for a foreign tour, how can we write unnecessary medicines? We need to understand, anything foreign to the body, the kidney is getting overloaded, it has to work excess to excrete that drug. Why can't it be natural? And when it comes to, the chronic illnesses, when it comes to how to live life in a better way, there is no other branch as Ayurveda, I think, which can subside the need. Definitely when it comes to emergency medicine, where if a patient is dying of heart attack, you cannot prepare a carda to give him, the patient will die till then. You have to give them injections of adrenaline. You have to stimulate the heart if it is cardiogenic shock. You have to give blood if you have to give plasma expanders if there is a hypovolemic shock. There cannot be emergency medicine challenge. At that time, allopathy is the greatest facility that we can have. But for rest of the time, for that patient not to land in this crisis of emergency, the lifestyle has to be good, and this can only and only be done by the branch of Ayurveda, because it's not simply a branch of medicine, it's a way to live life. But the problem is when Ayurveda comes into picture, so many people start barking. No medical background, no molecular level researches, etc. But everyone is doing it. They're doing research over it. We need to find solution. This is how it has to work in integration. Because Ayurveda brings a lots of restrictions and discipline in life, and people don't want to live in discipline because they are enjoying living like animals. I think animals are more disciplined than what humans are doing. Animals have a fixed time to eat, sleep, everything goes in cycle. We are only weird enough. And this is only because we all are running behind money. May it be medico, non-medico, we have lost the ethics of life because we don't know the purpose of life. And I want to drag your attention, ladies and gentlemen, to this point. And so, a solution to this I find is healthcare setups at a massive level. About the problem statement of the healthcare system, current attitude of the system of medicos, of general people in the population towards the healthcare system, and we talked about a solution of health cities. But what is happening, as I already told you, that there's a gap between the city and the rural area. Cities are having over-flooded facilities. I'm not talking about the COVID crisis, please, that's an exception. But otherwise, simply sneezing will get to MD medicine in the city. But patients suffering and dying of leprosy, TB or any other grave disease not getting facility because of lack of resources, opportunity, connectivity, lack of awareness, education, etc. So even if we build health cities in the cities, the problem is that we cannot reach the villages. So KY has come up with a concept called as PHC on wheels. PHC on wheels, that is primary healthcare service or centers on wheels, that is moving hospitals. We have already known about this concept. In many parts of India there are moving ambulances or moving like this, but they are not on regular basis. We are coming up with a plan and a budget which will subside the need, I believe. Now the plan is like, suppose there are 700 villages in the city of Solapur in Maharashtra. If we start a vehicle for 10 villages, one vehicle for 10 villages. So if the vehicle visits 5 villages every day for 2 hours each, so that is the vehicle will be functional for 10 hours. Now 10 hours if the vehicle is functional, if it starts in the morning at 8 o'clock, by evening 8 o'clock it can finish all the villages with their own leisure of lunch break, tea break, etc. And in every village for 2 hours when the vehicle is waiting, the medical officer, the nursing staff, or the brother and the driver with all the equipments, basic equipments and services that a PHC can provide, along with acute emergency management, especially like snake bite, scorpion bite or scissors. You know, these are the main problems, animal bites. These are the main problems in the rural area. And so when this can be focused, these facilities can be, basic facilities can be provided along with the basic emergency services. Like suppose if a patient is having cardiac arrest, till we shift the patient to the first referral unit or the health city or the district hospital, the vehicle should take care. Such kind of facilities like the cardiac ambulance with these basic facilities we need to have in this vehicle, and that can be done. Okay. Now if we forget time being for the emergency medicine or the emergency services which need more investment, if we talk about the basic facilities only, the vehicle should be of electric type, so there is no problem of fuel, because every village in India has electricity as per conveyed by the government of India a couple of years back. So electricity will not be a problem. So 2 lakh rupees we can have a single vehicle, and additional 2-3 lakh rupees we can have all the basic facilities, the bed and the the medicines and these IV fluids, etc., the basic things that we need, and with a couple of beds inside we can have. Now these 2 hours it will be like a moving OPD, outdoor patient department for those villages. And once the village, that vehicle is going every alternate day to the village, 5 villages one day, another 5 villages another day, again these first 5 villages will be visited on the 3rd day, these on the 4th day. Alternatively that vehicle will visit that village, and this, once the people are habituated, they will convey their problems. And definitely not every time the vehicle will go, they will not have patients so many in number that they will not be able to handle. So when there will be lesser number of patients, this vehicle and the people in the vehicle who will be paid or salaried or incentives will be given. It is their main and moral responsibilities to make people aware about health services, health education, self-hygiene and basic health related aspects. They should be provided information and knowledge. This can also happen by charts, role play, and once this comes into picture, the medical college students of MBBS or BMS can be trained, can be given fellowships, and weekends these students can visit these villages to talk, so that the understanding or the concept of seva is kindled in these young minds in the initial part itself, before the market enters their brain and their lifestyle. And I think 2 hours a village, so 10 villages one vehicle is covering. So if there are 700 villages in the city of Solapur, we need 70 such vehicles. If we need around 5 lakh rupees for one vehicle, so 70 vehicles we need, right? So 70 into 5, 7 5s are 35, 3.5 crore rupees, definitely the thing can be done. 3.5 crores in terms of the whole city is not much. And if we compare the 1,000 crore rupees or lakh crore rupees which the government gets from the revenue of taxation of only alcohol and tobacco. Now if we want to build this infrastructure for 6.5 lakh villages in the whole country, it will cost around 3,250 crore rupees, which the government can easily manage out of the 14 lakh crore rupees that it is getting. Sawa 3,000 crore, 3,250 crores is very much less as compared to the 14 lakh crore which the whole country is getting. This 3,250 crores will get vehicles for the 6.5 lakh villages in the country to give them basic facilities. Now talking about the economic management of the people who are working. So if in one village, if one house is giving 50 rupees per month, see, people spend 20, 30 rupees, 40 rupees on the BD that they smoke for one single day. We are asking them, requesting them, if they don't smoke for 1 week and if they pay that 50 rupees per month for one house, if there are 100 such houses, then 100 into 50 is 500 rupees from one village, and 5,000, I mean definitely this is the lowest number. The number of households in one village is more. It is 200, 500, 800 like that. So the number can increase the amount of money, or more the number of houses, lesser the contribution from each house. You getting me? So if 100 houses from one village, so 500 rupees from one village, such 5,000 rupees from one village, and such 10 villages for one vehicle will get me 50,000 rupees. In that 50,000 rupees, 5 to 7,000 or 8,000 can be given to the driver. Some 10 to 15,000 can be given to the staff nurse, and remaining 25 to 30,000 can be given to the medical officer or the MBBS fellow or the BMS fellow. Here money should not be the centric point, as I've already mentioned. Basic facilities can be subsidized in this amount of money. But there should be a feeling of seva, there should be an attitude and approach towards people's life, and patient-centric attitude should be there. And I believe if money is not the problem, if we can subside the basic infrastructure need of all the 6.5 lakh villages in a mere amount of 3,250 crore rupees for the whole, for the whole nation, I think this is an extraordinary thing. This is an extraordinary thing. And the salary that has to be given, that can be contributed by the villages, and that can be very simple. I think this way we can connect the villages, and the contact details of that vehicle will be given to everyone in the village, because it will become a routine for the villagers of that vehicle. And if this can happen, I believe if they are connected this way, if adverse conditions appear some night, somewhere fire catches up in the village, in some hut or like that, or someone getting a heart attack in the middle of the night, they can call up, and that vehicle should go to the village and shift the patient with those basic facilities to the first referral unit where patient will be treated. And the vehicle should stay in such a village which is nearby from all the rest of the 9 or 10 villages. As a result, it will be at the shortest distance that the vehicle can reach, maximum 8 to 10 kilometers. So the vehicle will reach within 15 to 20 minutes and will do all the necessary thing. And in these ASHA workers, Anganwadi workers, all these can be trained. The medical officer, the unit in charge of that vehicle, we can pay more to him to train these people so that they can aid and help in this process of healthcare system to run very smoothly. And I think this will be a very, very crucial, core, important, and an extraordinary simple step with cost effectiveness to deliver the healthcare system, to deliver healthcare services by this kind of system all across the nation. I think the 1 2,000 bedded hospital in one district with such kind of connectivity will play an extraordinary role in connecting lives, saving life, in connecting facilities, saving lives, and getting a better future for the country, I believe. So 2,500 bedded hospital with a few CHCs if possible, which are already existing, and this kind of connectivity by PHC on wheels will get us. So see, if we consider the state of Maharashtra, there are 35 districts. In 35 districts, we need 35 such 2,500 bedded hospital, which nearly require 1,500 to 2,000 crore rupees. If we consider 2,000 crore rupees for one health city, and if we consider 35 such, it means what? 35 multiplied by 2,000 crores. How much is it? 70, just see, 3,500, 35 into 2,000 crores. It is just 70,000 crore rupees. 70,000 crore rupees can be spent over a period of 5 years just from the expenses or the revenue that the government is getting as tax from the alcohol and tobacco industry. We don't want to disturb rest of the system. We are talking about the healthcare system and food industry. You're getting me? So this tobacco and all comes under drug and food FDA, na? So if it's getting approval there, 70,000 crore rupees over next 2-3 years, 5 years is not a big deal for the government for developing this infrastructure with 2,000 bedded hospitals each. So 70,000 crore rupees can do best for the state in terms of healthcare infrastructure. And anyways, government is paying all the medical officers, all the people. So that is not a big deal. It will not add much to the cost. Okay. And if it comes to the PHC on wheels, there are around 43,000 villages. Consider it as 45,000 villages, and divided by 10 means what? We need 4,500 vehicles. 4,500 vehicles, one vehicle is costing around 5 lakh rupees. So we get this within 22,500 lakh rupees. 22,500 lakh rupees. So that's certainly possible, I think, and cost effectively we can connect this way. Thank you.